everyone. This is for Lukowski's class. This is the IV school demonstration. First thing I'm going to do is implement my standard protocol, look at the MAR, look at the orders, which the doctor has ordered an IV for simple medication administration. But I'm going to choose a site that's above the wrist because my patient may have a potential for blood transfusions later. So I'm going to try and locate a spot that's less painful for the client. But I'm going to first go into the room and I'm going to let the patient know why we're doing the IV and what's been ordered, and see what he says. So I'm going to walk into the room. I've cleaned my hands. I'm putting on some gloves, introduce myself to the patient, and I need to verify who he is and his date of birth. So, Mr. Jones, can you please tell me your name and your date of birth?
Tom Jones, 5/11, 1964.
That's correct. Okay. Mr. Jones, Dr. Smith has ordered an IV to be able to give you some medication here in a little bit, and I'm going to select a site above the wrist because you might have to have blood transfusion later, so I'd rather go ahead and do this once and get it done with. So are you okay with that?
Yes.
Okay, good. And do you prefer a certain site over the other when they draw your blood work? Which arm do they typically use?
Doesn't matter.
Okay, good. If you don't mind, I'm going to take a look at your right arm. Alright, so the first thing I'm going to do, I've already done hand hygiene, I've got my gloves on. I'm going to go ahead and apply the tourniquet. I'm going to apply the tourniquet 4 to 6 inches higher than the site that I'm going to use. So I already know, because he has great veins, I'm going to use the lower portion of the arm. So I'm way past my requirements. My IV, or my tourniquet's out of the way, so I don't have to worry about it ruining my sterile field, or clean field. I'm going to go ahead and prepare my equipment now, and I have my INT, so I'm going to connect my saline flush, unclamp the INT, flush the tubing, clamp it back off. Okay, try to keep it back in my sterile area. Okay, now I'm going to go ahead and take a look at the arm, which has great veins, and there are 4 things that you have to meet. Like to the most distal site, which we've already talked about, the vein is nice and bouncy. And so I'm going to choose this one here. This is an area that's going to create less pain for the patient. They're able to move, and hopefully it will last longer. So I'm going to go ahead and clean the site first with vigorous rubbing to make sure we try to clean it as much as possible to decrease the risk of infection. You're a dirty patient. All right. So I'm going to let that dry for a few seconds. I'm going to go ahead and select my IV catheter, and this is a 20 gauge. I'm going to pull the skin back pretty taut. I'm going to go in at a 15-degree angle with the bevel up, and as soon as I see a flash in my chamber, I'm going to drop it down to 10 degrees, and I'll advance my catheter. So big stick. All right, I see a flash already. I dropped it down to about 10 degrees. I can let go. I'm going to advance the catheter at this point. Pull back my needle, it locks in place. I use gauze to place up underneath the IV catheter to try and collect what I can. Take off the tourniquet to release pressure. Apply pressure here. Connect my INT. Clean up the site if there was any blood anywhere. I'm still going to hold the site. Unclamp my INT. I'm going to flush a total of 3 mLs into the site with a push-pause method. Well, I'm going to aspirate first. There we go. A little bit of blood. Now I'm going to flush it. Stop. Flush. Stop. Flush. Stop. Alright, now I'm going to go ahead and clamp off my INT. Take off my flush. I'm going to go ahead and secure the site now. Okay. Okay. And this is in the distal forearm with a 20 gauge IV. And I'm going to use my tape to tape this down. Okay. And I'm going to document everything that I did. I'm going to fill out this little piece of paper with this type and the size of the catheter, the date, my initials, And I would fill that out and I would place it here on the side of the catheter. And then I would also document in my charting the site that I was used, how the patient tolerated the procedure, which he said was well. The site is nice and clean. There's no redness, there's no swelling, there's no sign of infiltration. And that's basically about it. And I only did it one time. So once again, my name is Angela Smith, and I'm in section 1, and I'm in Lukowski's class and adult health 1. Thank you.